Hello, I'm Dr. Brandt Gibson, and we already talked a little bit about repressing neuropathy symptoms, repressing nerve symptoms through medications. So today I'd like to talk to you a little bit more about other types of repression techniques. So let me take a step back. Remember, when we're treating peripheral neuropathy, there's really 5 different ways that we can do that. Number 1, we can repair the nerves, which is the ideal. If we can repair the nerves, they'll function better like they're supposed to. Number 2 is repression, repressing the nerve symptoms, basically decreasing the symptoms without doing anything to improve or heal the nerves. Number 3 is to re-educate the nerves. So you could actually go through and actually get the nerves to function like they're supposed to by getting them to communicate better with the brain and spinal cord. Number 4 is to reset the nerves. It's like shutting off a computer, turning it back on. So the nerves aren't working, so you depolarize, repolarize them, and get them to function like they're supposed to. And number 5 is to release the nerves, to give yourself the power over the nerves so that they don't interfere with your life. You actually take that power back and release them. And that is a powerful tool as well that we'll talk about in later videos. But today I want to talk about topical treatments for neuropathy symptoms. So topical treatments, the most common topical treatment that was used for years and years and years is called Capsaicin, which is basically a cream that overstimulates the nerves through the use of peppers. Basically, it basically creates a burning sensation. So you want to be careful how you use it. You want to have gloves on when you do it so that you don't get it on your hands, because if you touch your face, or if you were to go to the restroom or something like that, you can actually cause pretty significant discomfort just by passing that to areas that you don't want to touch with a hot burning type cream. So capsaicin actually works quite well. Some people find it very uncomfortable because of what it does. It actually overstimulates the nerves, can cause some pain to reduce or repress the nerve symptom pain. Number 2 is some of the creams that are used for muscle pain or for inflammation, like arthritis type creams. So arthritis creams or muscle creams like Icy Hot, BioFreeze, some of those kind of creams will actually decrease those symptoms and actually help you function like you're supposed to. Number 3 is there are compounding creams. So you can actually mix certain medications that work on the nerves into a cream, finding a pharmacy that will actually mix them for you and compound it. This needs to be done through prescription. It actually has to basically say how much of each type of anti-inflammatory or nerve modifying medication or whatever you have in the cream, so it actually causes the help that it can do for those nerves. Those are valuable. They're a little bit harder to get, but they can actually work as well. Number 4 is anesthetic type creams. Sometimes these anesthetic creams will do enough where you can actually rub them on and reduce those type of symptoms as well. Number 5 would be topicals such as essential oils or some of those other types of oil type treatments. Deep Blue, for example, is a valuable oil that can be used. There are multiple that really come down to doing something that actually reduces symptoms through the process of massage or so forth. And number 6 is the one that I want to talk to you a little bit more about, and that's CBD. CBD, we talked about in medications as a good medication that you can actually take for it. It can also be used in creams where you can actually rub it on the areas of most pain, and it works that way as well. In fact, some of them actually are in like a stick form where you can actually just put it on almost like a deodorant type thing where you're actually rubbing on the areas that hurt. It can work. It does work. It's another thing that should be considered. So when it comes to repressing symptoms, these are a valuable piece of the puzzle. Using topical treatments is a good idea because you can localize it to just the area that's causing your pain and causing you symptoms. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 378, repressing nerve symptoms through topical type treatments. It's a valuable tool that you should put in your toolbox. It is a valuable piece of the puzzle because there are going to be days, even if you're doing everything right and you're treating the nerves the way you want to, there's going to be days where you have some more symptoms and you need something that you can use to allow you to continue to enjoy your life. I'm Dr. Brandt Gibson. Have a great rest of your day.